Well, there is a big push in the medical world to find alternatives to opioids amid the nationwide epidemic. Many people first become addicted to these powerful prescriptions during surgery and recovery.
Jodi Goldberg shows us how doctors on Long Island are taking a different approach to pain relief for their patients.
These pictures are some of the only memories Jonathan Akinrelay has of himself prior to undergoing weight loss surgery in March of 2021.
I weighed 345 pounds.
Now down 130 pounds, Jonathan is happier and healthier.
My life has changed dramatically.
He's one of more than 150 patients to undergo what's known as opioid-sparing surgery or enhanced recovery, performed by doctors at South Shore University Hospital in Bayshore.
We give you medication both preoperatively and postoperatively, including very strong anti-inflammatory medications, also very strong local anesthetic agents that last for up to 3 days.
Doctors say it's similar to any minimally invasive surgery, but avoids the use of opiates during recovery.
The idea is that if we can turn down the nerve endings in the operated area before they become excited, the centers of the brain that receive those impulses never become quite as excited.
Becoming addicted to pain pills is one thing Jonathan didn't have to worry about when going under.
I did feel a sense of relief that I didn't have to take any opioids because, I know people can get addicted.
According to doctors here at South Shore University, the addiction rate in patients receiving elective surgery who have never taken opioids is about 3 to 4%. But for weight loss surgery, the addiction rate jumps to 10%.
Patients who have had weight loss surgery who can no longer eat the quantity of food that they ate in the past shift their focus to other things, such as drugs or alcohol.
Drug experts believe any alternative to prescription opioids is a step in the right direction.
It means that folks who would get this procedure no longer have to worry about bringing opioids into their homes where their kids or other folks could actually abuse them. And for folks who might have a predisposition to opioid addiction, it means eliminating that risk from the equation.
The opiate-free surgical program also shortens the length of recovery and hospital stay by up to 75%. Jodi Goldberg, Fox 5 News.